how much of, I mean, demystifying is the perfect word for it. I think you're spot on there. How much of the darkness surrounding what we thought therapy was in sort of the 80s and 90s and so on, how much of that do you think comes from Freud's idea that the therapist should be as objective and as passive as possible so as to not influence the unconscious emerging? The way that I think that's a brilliant theory, but as attachment theory started to really take off, and we started to look at how infants would respond to, mothers, for example, with neutral faces and things like that, it very quickly it became obvious that we mirror each other and we only feel safe in the presence of authenticity. So, what do you think about some of those ideas?
Yeah, well, Tom, when we talked a while back and we were uh, on someone else's podcast, you and I were thinking, wow, you and I are simpatico on a lot of things. And your question here is evidence of that because this is something I think about a lot
Mhm.
and I could talk for a long time about it. It's hard to fully comprehend who Freud was exactly, what he actually believed, and also what people took away from him and how that was morphed over time and of course very much simplified today. uh, the objective listener, that is psychoanalysis, is of course one of the supposed tenets, but Freud himself, if you actually especially if you uh, read or study the span of his career, because he was writing for, I don't know, 50, 60 years,
Yeah.
I guess 50 years, well, maybe 6 years. And he changed his mind on a lot of things. And he was also, right now, uh, we still are striving to justify our existence as a field. There are coaches, for example, that are coming forward saying that therapy is about the past, and it's like, that's ridiculous. But there's all these threats and ideas. And it's like, well, isn't therapy just talking to a friend? And so, we still,
Mhm.
but imagine if therapy doesn't even exist. It doesn't, it's never existed. It's a completely bizarre, it's like talking about magic. And so Freud was out there he was the only one. He
Yeah,
had
yeah.
his people, but he was the only one. And so he's not only trying to justify it to, to other clinicians who are mainly physicians, right? And saying, hey, come on over to, it's like a specialty in psychiatry, but he's also trying to justify it to the world, trying to get a market going. And, meanwhile you have, well, I go the history of Eastern Europe and Germany and world, built in the 30s anyway.
Mm.
But um, and prosecution against Jewish people, but
Mhm.
because a lot of the early psychiatrists and psychoanalysts were Jewish, but so it's hard, and so Freud, if he was alive today, I think would relax and allow himself to be a little less rigid about things.
Yeah.
The objectivity, prescription, Freud himself didn't really follow as much. And so he might have been saying that to try to make us seem more scientific and less of a friend, and also trying to teach all these random people, like, hey, make sure, a lot of his pupils, some notable ones, were having sex with their clients
Yeah.
when it wasn't considered an ethical crossing. It certainly wasn't illegal. You had men and women that were, Jung, Ferenczi, Karen Horney,
Mm.
others, prominent people that are household names in my household anyway, um, that not only were having sex with their patients, but were marrying some of them, and some of them were like with Ferenczi, it was like his patient's daughter or something. Anyway,
Mm.
so Freud didn't do any of that stuff, and he's like, hey, um, like, I'm trying to get this thing going. Like, how about some objectivity, please? Counter transference. Work on, stop with the your feelings. It's not about you. And so, um, it's hard to take that out of that cultural context and look at it through our lens today and say, like, well, I was kind of rigid. But,
Mm.
there's kind of reasons for that. And with attachment, what I'll say is that, yeah, for you and me, we understand the importance of attachment, but most people today don't
Yeah.
understand that. Most clinicians don't understand it. I will talk to people that aren't really in my circle, and I'll bring up the topic of attachment theory, and my impression is that they tend to see it as an early childhood
Mm.
concept and like a parenting of a 2-year old kind of concept, or they only consider it relevant to the very few attachment related disorders that are in the
Right.
DSM, which are very rare conditions, by the way, mainly applied to children.
Mm.
And for me, and it sounds like possibly for you too, Tom, that I find attachment theory to be the basis of everything. It's the whole reason for all the stuff.
Yeah. Yeah.
Whether it's uh, talking about our marriages, our children, our parents, our friends, but also between nations, between us and neighbors, but the feeling of safety
Yeah.
versus the feeling of danger, and what do we do when we feel unsafe? Where do we run? And if we don't have a secure base to run back to, how do we manage that? How do we cope with that? All this stuff. Attachment style is related to conspiracy theory adherence. It's related
Mm.
to the way you vote. It's related to how you conceptualize news. So, it's to me, it's everything. So, and I also wonder if Freud were alive today, learning about the research that you mentioned about the early childhood lab experiments about the facial expressions and the separation experiments, that the strain situation, I mean,
Yeah.
that I think Freud would be interested in it, and I think it would fit well into at least one of his phases. He had a trauma phase that he was in that would be very familiar to us today. He abandoned it for reasons that I won't bother everyone with, um, but he was, potentially open to that. But he didn't have anyone that was supporting him in that because I mean, he had some, but he was, mostly on his own. But, yeah, the thing that I worry about today in terms of trends is that, th- as has been going on for the past 30 years of observing, is that the cognitive therapy, CBT movement
Yeah.
has been very effective. And it's kind of a lobby. I use cognitive therapy, I use behavior therapy all the time. You would be, uh, I think, a terrible therapist to not understand these principles and not use them when they are necessary. Um, but to displace all other models and to attack all other models as not evidence based, as will be said sometimes, I think is um, really unfortunate. And, you have all these pressures put on schools and
Mm.
novice therapists that result in, um, like you take a institution that's trying to train therapists, and they have all this pressure from the outside, from accreditors and from administration and blah, blah, blah. And it's so much easier just to teach CBT than CBT and attachment theory and psychoanalysis and systems theory and humanistic
Yeah.
psychotherapy. My God, right? Um, it's too hard. So we'll just do CBT. They'll get that down pretty well, and we'll check the boxes for marketing and administration and
Insurance
for
companies.
insurance companies for for accreditation. And I don't have, enough time or energy to fight that. And so it's to lose psychodynamic um, theory and to lose humanistic theories is, I think, just a huge mistake. Huge mistake.
Yeah. I couldn't agree with you more. And I think it's part of the reason. I wouldn't say it's a major driver because this is obviously so multifactorial, but I think it's definitely a part of the reason as to why at least in the West, we're really suffering from a crisis of meaning. It's because if we're telling everyone that the fundamental issue is within you, and here is a list of evidence-based interventions that are going to help you, go away and do your thing and you'll be happy. Well, so much of a human being is relational. The experience of being alive is relational, at least as far as I've experienced. This is part of the reason why I love my friends and I love my wife, but I love my job because I'm attuning to the clients in the here and now. And it's a beautiful, beautiful experience. And just to say, it's some clunky thinking. That's why you're really nervous about how to make this decision or whether to stay in your relationship. It's just so superficial, unfortunately.
Hmm. I mean, it can work, and there can be
Sure.
applications, and for some people, that's the answer or that's the path or whatever. But yeah, for most people that are suffering, it's much more than that. Yeah, and you put it well that it essentially blames the individual, right? Someone that was raised in an insecure attachment household and has gone through losses and grief and is not feeling well and has symptoms and addiction, maybe, or anger, depression, whatever. And they go to a therapist, and it's just like, well, you're thinking wrong, is essentially the message. You just have to, instead of waking up in the morning and saying that you're a loser, just say that you're a winner. Instead of telling yourself that you don't have any friends, just tell yourself that you do have friends. It's just how you look at it. And yeah, I'm not saying that there isn't a time and place for that. There, I do that
Course.
kind of work all the time, depending on the presenting problem. But what if we actually valued that at the baseline of our biology is a need for human attachment, secure attachment, people that are in our lives. You know, I, decades ago, when before I met my wife, I lived, mostly alone, and I was fine. If you asked me, I'd say I was happy. But marrying my wife, moving in with her decades ago, and after the initial period of sort of adjustment to living with someone, all the time, um, I couldn't believe how much better I felt. I didn't know that I could feel as good as I felt. Just sort of relaxed and even keeled and stable, um, things that in the past I would have seen as just normal ups and downs of emotion or impulse or of I don't know, distress. I now see as just evidence that I was alone, and it's
Mm.
normal
Mm.
in our society, in Seattle, others as well, that if you're not married and you can afford a shitty little apartment, in the outskirts of town, you would much prefer that than living with other people, particularly like your family. I mean, who wants to live with your family for crap? I mean, it's the American dream, is to get as far away from your family as possible. In other cultures, that's uh, totally counter to the
Mm.
values, for better or for worse. I think there's good messages and maybe some bad messages, but yeah, and I was a therapist this whole time, so even for me, I didn't value even for my own life that importance.